Here I'm going to speak on the guidelines which are prepared by the Central Pollution Control Board, specifically which gives guidance on the management of COVID-19 biomedical waste. Whatever biomedical waste which is generated from the hospitals, from the home quarantines, from the quarantine centers being set up by the government for the treatment or diagnosis of the COVID-19 patients. So these guidelines we have, CPCB has prepared these guidelines just to give slight more precautions to be taken during the whole management of this COVID biomedical waste because of the obvious reason. This particular virus is very contagious in nature, and we don't want any kind of situation with us which creates just because of the mishandling of the waste. So it is as normal as other biomedical waste. Only thing, small steps needs to be ensured by the hospitals, by the every other concerned stakeholders. So this is the guidelines, which the topic of the guidelines had handling, treatment, disposal of waste generated during treatment, diagnosis, quarantine of COVID-19 patients. So this guidelines cover specific duties which belongs to the hospital, belongs to the quarantine centers, belongs to the urban local bodies, belongs to the common biomedical waste treatment facility. We have one of the common facility operator which is located in Delhi. I'm sure he'll cover all the issues or maybe challenges or maybe the good practices being followed by them, and especially during this COVID pandemic period. So this is the guidelines, and this guidelines, we come out with this guidelines in early March, and with time we have 4 revision of the guidelines. Revision means it doesn't mean that the entire guidelines has changed. Revision means we have given time to time additional duties or some of the very important clauses which are required for the situation we have. So applicability of this guideline is, of course, I've already told you, hospitals, even the small sample collection centers, testing labs which are involved in testing of COVID-19 quarantine centers, common facilities, state boards, and urban local bodies. So these are the important stakeholders in the whole situation. This is a small I can say flow chart. So once we have the waste generated with us from anywhere, from hospital, from any other camp or center, quarantine centers, etc. So once the waste is generated, what we have to do next? So as I already said, it is as same as the other biomedical waste with us. So the existing legal framework, the Biomedical Waste Management Rule, will apply here, which talks about segregation as per the color coding system. So as it is already stipulated under the said rules, we have given a very detailed table in the rules which gives us the categories belongs to which color code and what the treatment disposal option for the same. So here also it is same. In fact, because we have huge amount of PPEs with us. In fact, very new kind of PPEs being used by the doctors, used by the nurses, which usually they don't use until unless very critical medicine is required or treatment is required in the hospital. So nowadays we have very commonly used masks and gloves, and but other uncommon PPEs are also there, like hazmat suits, face shields, coveralls, plastic coveralls. So people were confused. Where do we put, or if we are going to segregate this thing as per the biomedical waste management rules, so in which color coded bins we will drop this or we will store this kind of waste? So first step is segregation, very basic step. Then again these temporary storage at the site, and then the collection by the common facility operator, and then its treatment and disposal, final treatment and disposal. And yes, if it is a plastic biomedical waste, no matter it is coming from the COVID-19 isolation ward. If it is plastic, hard plastic, I'll tell you the name of few items also. After the treatment, it can also go for recycling. This is not the thing that it is coming from the COVID-19 isolation ward, so simply we are going to burn it. No, as per the rule, we will segregate it, and if it is belong to the red category, which is meant for the recycling after, of course, after the treatment, then it may go for the recycling. So this is the a normal setup for isolation ward where a patient is there, doctor, nurses are there. Then the again segregation, then it's temporary storage at the hospital. Then of course the vehicle is there, the worker is wearing full PP and he's handling proper labeling. Separate labeling is required for the COVID-19, just along with the biohazard label. There's another requirement to put COVID-19 waste with that. So he's collecting the waste from the hospital, and the waste is being received at the treatment facility, and then it is going for the respective treatment. Next is, I'll start with the hospital. I'll start with the isolation wards where COVID-19 positive patients are there. So there again, segregation I've already talked on. Now I'll like to mention few of the items, which I was talking about, which will go in which bag. So for example, if you see point number 3, so which says collect used PPEs such as goggles, face shields, splash proof aprons, plastic coveralls. These are all made up of polypropylene plastic and may go for recycling. After the sterilization, after proper sterilization with the use of autoclave or microwave, whatever the treatment equipment is available with the common facility operator, he will sterilize it and he will shred it, and he will go it to the recycler for further recycling of plastics. We don't want to generate another kind of waste if we are treating one kind of waste. So that's why after sterilization, this is as good as general solid waste, and we'll just shred it so that it cannot be used in its original form. So we'll shred it and we'll send it for recycling. Then very important point is there are some PPEs which, for example, masks. It includes both triple layer mask and N95 mask also. Head cover, shoe cover. These are not a very hard plastic PPEs, and for this we have said that you simply segregate in yellow bag, which will definitely go for the incineration. There was also one doubt, because I'm only mentioning few of the which are not common in biomedical waste management, but at the hospital, being doctor, he was also confused at what to do with such kind of things. So that's why I'll just cover important points which are not common nowadays or before the COVID pandemic. So red and yellow bag I've already talked on. Still there was a query like what about the like, for example, there is a patient, he cannot go to the toilet, he cannot use the toilet on his own. So what happened with this feces waste? So we have said, we have covered this provision also in our guidelines. You simply, if you are using bedpan, you clean the bedpan with the any disinfectant, for example, sodium hypochlorite, or then wash it with any other detergent with that. So such kind of thing. And if the patient is using diapers, then you simply throw that soiled diaper in the yellow bag. So this kind of things we have clarified. In more clarified manner, we have covered in this guideline. There is no new thing in this guideline, only some more clarification is there. Next is, because everybody is, in fact, our legal bodies, our court and National Green Tribunal, including Supreme Court of India, they were reviewing this whole COVID waste management in our country. So because of their directions, government wanted to track this waste. We do not want to have pilferage or the any kind of situation which says that the COVID waste is dumping here and there. So we want to have a track on that. Then accordingly, CPCB developed one tracking app also. So this is again another requirement to be followed at least during the COVID period by every other stakeholder. So this app is very user friendly. It's very easy to use, but it has to be used on daily basis for feeding the data on daily basis. So this is the another requirement by being followed by the hospitals. Next is, for example, if I'm talking about the segregation, or I'm talking about the storage of the different categories of biomedical waste in their color coded bins. So another precautions, as a precautionary, we have given one provision which talks about double layer storage of the waste. I mean, the person will use 2 layers of bags inside the container or bin, whatever he is using, so that, you know, while transporting the particular bag, the bag cannot be teared, and there should be no leakage of the waste from that. And again, of course, there is a disinfectant of the bags from the outer layer, and the bin from inner and outer layer. There should be a disinfection after every use. Then the separate record maintenance is there, and training is there. Training is very important in this whole exercise, because training will talk about such small things which will be followed by the nurses, which will be followed by the other workers, waste handlers, class 4 employees. If these people are not trained, then we cannot achieve the the management at the level we want. So this is I tried to put on a small isolation ward setup. So where the patient is being treated by the, given treatment by the doctor, there we have waste, of course we have waste. So in red bag, we can drop used syringes, IV sets, PPEs, which I've already talked on, what kind of PPEs, and nitrile gloves, and all other recyclable biomedical waste. In yellow, they will drop used mask, head cover, gowns, non-plastic or semi-plastic coveralls, anatomical waste, soil waste, whatever which are listed in the biomedical waste management rules. Then this left side, the worker is holding one bag, which is a double layer bag, and there is a spray which shows that before the dropping that bag into that container, there will be a spray of disinfection. And of course, after when a worker will take away that bag from that container, again there will be a spray of disinfection, so that there will not be any chances of this virus in there, presence of virus in the container. So and of course the doctors are wearing full PPEs, mask, head covers, gloves. So this will all go to the, after the use, of course, to the biomedical waste containers. So this is a temporary waste storage area at the healthcare facility. So there also, whosoever worker is involved in the handling of such COVID-19 waste, he will wear appropriate PPEs being given by the hospital management. And again, when the common facility operator will come to collect the waste, such kind of handling is required, which is shown in this picture. And there is a labeling of biohazard, there is a labeling of COVID-19, which we have asked through such guidelines. Next is, again, I've already talked on this, what will go in what kind of a container. Next is, we have hospital, so we have biomedical waste, but we also have solid waste from the hospitals, and solid waste which is coming out of the isolation ward of COVID-19. So earlier people used to think that every waste, even if it is a solid or biomedical waste, everything will go in the yellow bag or in the bag which belongs to the biomedical waste category. So solid waste, for example, the wrappers of medicines, syringes, fruit peel-offs, these are not biomedical waste, even if they are being touched or being used by the patients, because medicine wrapper, only nurse will handle this medicines and syringes wrappers, and she will take out the syringe and throw the wrapper. So that wrapper is not the biomedical waste. This will not go into the biomedical waste bin. fruit peel off also. Any kind of food waste will not become the biomedical waste, even if it is inside the isolation ward for the COVID-19 or ICU ward for the COVID-19 waste. So just we have said, we have repeatedly said through our guidelines, through every other channel which are we are following, through news articles or through pictures or through do's and don'ts, that just to minimize the waste, use the non-disposable items. Because of this, because in the earlier days of this pandemic, we used to there was a sudden increase in the quantum of waste. And who were the sufferer? Our common facility operators, because they had to collect the waste and they had to run their facility beyond their capacities because of the huge amount of waste, because the biomedical waste was only 20-30%. Rest, it was the solid waste. And then we clarified this in a more simplified manner, that please do not throw solid waste in the biomedical waste. So this kind of very important thing where hospitals need to take care of. Next is solid waste. Again, as per the solid waste management rules, the existing prevailing rules will be followed by the hospitals. And there was one more query related to the wastewater management. In other newspaper also, we were having so many of articles which, you know, talks about the spread of this virus through the wastewater medium. So even as on date also, I don't have any certain study on that which says that there is no spread of disease through this, or there is a spread of disease. But still, in the consultation, with the consultation of many experts, we come out with one thing at least, that the sewage treatment plants installed at the hospitals, the workers involved in the operation of those STPs or ETPs will follow the hygiene practices, will follow the disinfection practices, which are, you know, the separate guidelines are there issued by Ministry of Health for that. And the other thing, that they will have the appropriate, they will wear appropriate PPEs all the time while handling this ETP or STPs. Other than that, initially we have asked to stop the recycling of the treated water inside the hospitals. But now I think it's a time we can remove that from the guidelines, but still it is there. Now I'll come to the home quarantine or quarantine centers. Everything is same. The only difference is that in the quarantine centers, although we don't have quarantine centers nowadays, because for mild symptoms or for asymptomatic but positive patients, government is asking, hospitals are asking to stay at their home and isolate themselves. So again, we have some few but some kind of biomedical waste from them. For example, mask, gloves, or if a person is having diabetes or any other disease already other than this COVID-19, so some kind of waste will be there. So we are asking them just to follow a small practice, very simple, that they store that biomedical waste in a yellow bag. That yellow bag can be provided by the urban local bodies, municipalities, because we have asked them to go every home care or home quarantine to collect such waste along with the other solid waste from that particular home or center or camp, whatever it is. So just to segregate the biomedical waste, and we have, what we have left with is the normal kitchen waste or solid waste from the houses. Then the quarantine centers will have the agreement, direct agreement with the common biomedical waste treatment facility operator, so that he will maybe on call basis, or if the waste is very regular and daily basis the waste is generated, then on daily basis the operator will come and collect the waste. I'm sure Mr. Pranav will clarify this, how he is managing this practice in Delhi, because in Delhi we have quarantine centers, we have a huge number of home quarantines and home cares. So this is the thing. Urban local bodies are involved in make a channel between the home cares or home quarantines and the common facility operators, because every home person cannot go or cannot have an agreement with the common facility operators, and the operator also cannot go each home for their area to collect the waste. It will be a next to impossible exercise for them. So we have involved urban local bodies or the local municipalities to complete this exercise. They will collect the waste from every home for their respective areas, and they will set up some, if required, they can set up some collection centers where they can temporarily store that waste, and from that point the common facility operator can collect that waste. So here the role of urban local bodies and municipalities is very important. And as Satish sir was asking me that for in small towns or villages, how the waste can be managed properly as we want in that manner. So for that I will say, we have given, in fact, CPCB tried to give a model plan which can be followed as it is for the management of biomedical waste or solid waste. And so in that we have said that the village panchayats can be involved in that, and through them, village panchayats, then they can take up this matter to their higher ups, and the entire, for example, in a village there is a positive patient, so how it can be the very first step that to make him quarantine. So at which places they can have, and what kind of quarantine centers they can have. So such kind of things we have given in that model plan. If anybody wants to see that, it is readily available on our website. So with the help of village panchayats and local panchayats, we can still have the management, good management practices for the small towns, for the villages and small areas. So this is it. And yes, we have masks and gloves in a very huge quantity nowadays, because everyone is required to wear the mask when he's coming out of this house, of his house. So what will be the step for the disposal of those used masks? We cannot just throw it anywhere on the roadside or anywhere in our house. I was also wondering what to do with this used mask when I was going out. So then we given this provision, just to, if you want to throw out the disposable masks, just keep them separate for a minimum of 3 days, 72 hours, and then you can dispose it off with the solid waste or with the other general waste of the home, of course after cutting or shredding, so that there will not be reuse of that used mask. So this is the home, this is the quarantine center, one of the quarantine center being set up by the government, and only yellow bin and black or any separate bin for general waste will be there. Right side we have a home care where a positive person is there, and the home that person caretaker is also there wearing full PPEs. So this, just I've already explained what kind of exercise they can follow. Next is the common biomedical waste treatment facility operators. They are the I must say, I don't have a word for them, but without them we cannot achieve we cannot manage our waste, I must say, because okay, for biomedical waste management or treatment and disposal they are there, but all of a sudden we had this pandemic situation with us. Since WHO announced it is a pandemic, everybody was in panic, but at that moment we asked them to take care of the situation, and they did it. Still we asked them to follow certain important practices, for example sanitization of their workers, because their workers are going to every area where COVID-19 patients or people are there. So proper sanitization of their worker, they will give adequate PPEs to the workers, and there will not be any kind of wave off which says that we don't have PPE and we are sending workers. No. The extent to the possible, every government also helped them now, because we have clearly demarcated the items which will go in the biomedical waste, which will go in solid waste. So the amount is also reduced somehow, and they are broadly I can say they are able to manage the situation. They are doing a good job. We have asked them to use a dedicated vehicle for the collection of COVID waste. There will be a separate vehicle which will collect the COVID waste from their member healthcare facility or the quarantine centers. That vehicle will be, of course, there will be the sanitization practices is same for all, for the workers, for the vehicles, for the containers in which they are collecting the waste. So dedicated vehicle is one, then the sanitization is two, and then the immediate disposal of the waste is three. So this is the only requirement we ask them to follow, and to maintain the separate record for the treatment, so that we could able to see how much is the waste, what is the trend in the generation, so that we'll be ready to have, if required, to have more facility, or to have uh, uh, treatment facility available with us. Next is, as I told you, that CPCB has developed one tracking app. So common facility operator are also required to use that app for feeding data with respect to the COVID waste management on daily basis, and then of course provide regular training to the workers. Next is duties of state boards. So state boards are the overall responsible agency which will take care of the biomedical waste, COVID-19 biomedical waste for their states and their union territories. They will allow, in fact, they in the initial days, CPCB has given some advisory to the state board that they will not, because there was a complete lockdown, but we have asked every state that to make the smooth functioning of the common facility operators for their movement, so that their vehicles can move for the collection of waste. So state boards did that, and next is they allowed the operational hours for the common facility operators, because when they issue authorization to the operators, they usually say what this is the amount of waste you are going to handle, and these are the operating hours. But we have said clearly that there will be no restriction on the operation hours if required for the disposal of this waste, COVID waste. So this kind of duties we have given to the state boards. Next is wherever a captive treatment facility is required to be used, they will allow, because as per the biomedical waste management rules, the captive facilities, the hospitals cannot have their own captive facilities if the common facility is available in the area. So but just for the disposal of COVID-19 waste, we have asked them, if situation wants, then you will allow the use of captive treatment facilities. And if in case it is not enough, then they may allow the other incinerators also, for example, hazardous waste incinerator or other industrial incinerator for the disposal of same. And of course, there will be a coordination between the urban local bodies and the common facility operators and the home quarantines and home quarantine centers. So state board shall have the knowledge of all, and they will coordinate the things in every other stakeholders. And of course, there is a requirement of reporting of COVID data through this tracking app by the state boards also. This is a thing. Urban local bodies, I've already talked, covered the important parts, that they will communicate with the treatment facility operator. They will communicate with the home care or home quarantines for the collection of biomedical waste as well as general solid waste, and they cannot say no to this. This also we have clearly indicated in our guidelines, that they cannot say that we just, our workers are not going, or we cannot collect the waste, and they can today is coming, next day is not coming. It should not happen. If it is happen, if we have observed that it is happening, then of course we are taking some very strict action against them. And to provide the yellow bags, it is a responsibility of them. They will also use a dedicated trolley or cart or vehicle, any way they want to use, because in the small areas the vehicles cannot go, so they can use the cart or other trolleys, and of course there will be a disinfection of the same. Then the establishment of deposition centers, if only it is required, for the temporary storage of this COVID-19 waste. And there will be a person who will be responsible for overall management of COVID waste in their area, to feed the data on this tracking app, because In fact, Supreme Court of India is also monitoring one-to-one with every other district municipalities, and they are that is why the dedicated nodal officer is very much important in this. Next is yes, the last. I think this is the last or second last slide of mine. The used PPs by other households or by commercial centers or by offices, because now we have open market with us. Offices are open, everything is open nowadays, so we'll be having used mask and gloves. So as I explained earlier also, that there is a special requirement to store this waste for 72 hours, and then after cutting and shredding, it can be disposed of with the general solid waste. So this kind of things we have given. Next important point here is, yeah, PPE doffed by healthcare facilities at the crematorium or graveyard, because there are number of people who are dying with this COVID-19. So there are healthcare workers who are going for the at the crematorium or graveyard for the dead, along with the dead body and his family members also. So there will be a huge amount of PPs, and we had bad complaints or news articles also that PPs are thrown away around the crematorium openly, just like that. So then we, in our last revision, we issued such options to be followed by the people or by the hospital staff for the disposal of such PPs. For example, there could be a separate bin to be kept at the crematorium or the graveyard for the disposal of such used masks or gloves. Or the second option, that dispose as domestic hazardous waste or biomedical waste may be deposited at a designated deposition center if it is set up by the ULBs around nearby the crematorium or graveyard. Next option is we may ask healthcare facility staff, in fact, to take back their used PPs after collecting it in a red and yellow bag and keep it separate at the hospital premises in the storage area. Now, last option is that we may ask the healthcare workers to doff their PP at the hospital only, not at the crematorium or graveyard centers. So this kind of things we have covered in the guidelines. This is a small picture how our tracking app looks like. Just who will use hospital, every waste generator will use this app, every common facility operator will use this app, and his transporters, his vehiclers who are involved in collection of waste will use this app. So this is the app. This is the previous one was the mobile app. This is a desktop app also. It is required to be used by the state boards and the common facility operators. That's it, for giving their manual data through this application. Next is we've given some do's and don'ts. Simply, quickly, anybody can read it and follow the same. Do's and don'ts for the quarantine camps and home cares, and do's and don'ts for urban local bodies also. We have circulated this in every state. They in fact, some of the states have translated in their local languages and given in the newspapers, so that people are also aware what should be what they should follow for the proper management of the waste. So thank you so much. If anything I missed out or should be covered in my PPT, kindly let me know. Thanks a lot.